guys, long time no see. It's been a hectic semester, but I'm back, and I'm back with tons of videos. I'm gonna upload one every week from today because I want to upload one at least today and give you guys something. So far I have at least, I want to say 13 ideas for videos, so I'm really excited to do that. This video that I wanted to do today was one that I've been wanting to do since I started the semester, and it's the what's in my clinical bag. So this is Callie, by the way. So I wanted to start off with what's in my clinical bag because I feel that it was really important that I kept certain things in here that would keep me organized throughout the clinical shift. So let's get started. I got this bag off of Etsy, and I think it's 16 inches long, but basically has my name on here, has a little nurse's emblem on there. I carry hand sanitizer on here. We're not allowed to use our own hand sanitizer. We're supposed to use the one that's in the hospital because that's what's approved. So I have this for when the day's over. I use this, and it's also stress relief, so yeah, I need that. In this front pocket right here, I keep tied. There's been 2 times where I've actually needed this, and I've had other people wanting to use this as well. So I'm sure everyone's seen it, but I've used it because I spilled coffee on me and I actually started bleeding one time, and I got it on my white shirt and it came out, so yay me. I also carry pen lights. I don't use these, but in case I ever needed one and my other one just, you know, ran out, I have these, but they are a little bright. They are LEDs, so I don't think I'm going to be using these just because they're so bright, and I don't think I'd want to blind one of my patients. So I have 3 of those, but not sure why I keep them in there. These are extras. I have my scissors, and I have my hemostat. My hemostat and my scissors. On the sides, you have the little mesh here, and the same on the other side. On the back side of my bag, I have a little 4-color pen. This has come in handy when I've like lost my pens, and this is where I keep my Kalo ring. So I bought a Kalo ring. I'm not married, but I really wanted to wear my engagement ring while I was at clinical, but it was just too much. I guess I just didn't want to go to clinical and just have all this disgusting stuff get in it. So I just got a Kalo ring. So then I have the extras to my stethoscope, and then I also have some whiteout. This is just for my stuff. I don't use it on any of the hospital papers. Neither do I even use the hospital papers. I'm just charting online on the computer. I carry some bandages because of that one time that I started bleeding. My hands were so dry that my cuticle started bleeding while I was doing a head-to-toe assessment on a patient. Just be prepared. I have these from just another clinical shift. They just got in my bag, and they're good to have too, so you can clean your stethoscope and your supplies before you go into another patient's room. More pen. I have a glove. And I have extra earbuds that I bought for my stethoscope. More band-aids and some tabs just for when I'm doing my med pass. I can just quickly tab the meds. Over here I have this little notebook. I'm just covering up the bottom because I have my school's name on here. But I keep this in case, I keep this in my pocket in case I need to write down vitals really quick and I'm not at the computer, or just little notes that I need to know that are from the nurse. On the inside, I have my little bag that I got from Target. It's really cute, and it was just from the dollar section. I don't think they have it now, but I loved it when I saw it. And here I just keep my feminine products and some tissues, some Post-its, and some lotion and a lip balm. The lotion I don't really use because It does have a fragrance, and we've been told not to use fragrance lotions when we're working with our patients because they can be sensitive and get allergic to it. So I've only been using it like after we finish. And then I use the lip balm, the EOS lip balm. And then I have my stethoscope. So I have the Cardiology 3 Littmann stethoscope. I'm going to do a review on this in another video. I have my pros and cons with this, but I want to definitely I definitely want to tell you guys what those are. So if you're planning on going into a nursing program and don't know what stethoscope to buy, I got you. All right, next I have my my pocket protector, and this comes in so much. It comes in handy so much, and I love it, and it just keeps everything organized. I have another hemostat and another scissors in here. These are the ones that I use primarily. I've never used my hemostat though, not yet, that is. My 4-colored pen, my pen light. This is disposable, and it's not an LED, so it's nice and lower powered, I guess you could say. I don't know. And then I have my Sharpie, which is something you really need in clinical because you need to, like if you're putting on a bandage or a Mepilex or anything, any kind of dressing, you need to write the date, your initials, and whatever your school requires you to do. And I also have a pencil. I have my binder. So basically this is just where I keep papers that I need to turn into school. So I keep those in here. I keep all my medications in here with all the information to them, like what kind of medication it is, what's its class, its purpose, its action, the recommended dosage, and side effects, assessment, labs, and teaching for the patient. That's for each medication. So I also keep some references, and then I also keep, so if I have 2 patients one day, I'll designate one folder to one patient and another one to another. They're the tabbed with the pockets, and they work really well. So I like that, and it keeps me really organized. I also keep just blank paper so that I can write down the report in the morning from the nurse. I plan on making a template for that, so when I do come up with that or get it from someone, I'll be more than happy to share it with you guys if they would like me to. And then I also keep another folder in here, and this basically just has our handbook and the hospital's procedures that we need to have on us at all times. This is what I bring to clinical every day. I know it's big, probably a little bit bulky, but I love it, and I would not like to bring like my personal belongings into a hospital. But some other things that I sometimes bring into the clinical, if I need it, usually it's gonna be my drug guide. Now you can get this on an app, but I just bought the book, so I just bring it with me, and it's easier to just like tab the meds on the side. And then I also use this one, so we need to come up with nursing diagnoses every week for every patient, so you can also get this as an app I hear. If I do end up getting that app and getting the add-ons, I'll definitely talk to you guys about that. But all in all, that's pretty much what's in my clinical bag, and if I add to it or take something out or not have it at all, I'll let you guys know. I know that next semester where we're going, the nursing lounge doesn't really have any room for that big of a bag, so I'll probably just plan on bringing like a little backpack specifically for clinical. That's about it. All right, I'll see you guys in the next video. Have a great day. Bye.